A patient is combative in the field, and please ask you to sedate them with ketamine. When is this medically appropriate, and when is it not? Let's talk about it. Welcome to Medic Outpost, where we bring emergency department thinking to the field and practical medicine to the medics who need it most. Because when you're the medic on scene, the emergency department begins with you. The content presented on Medic Outpost is for educational purposes only and is not intended to replace medical direction, clinical judgment, or local protocols. Always follow your agency guidelines and consult your medical director when making patient care decisions. Today, I want to take a look at ketamine use in the pre-hospital setting. This episode will really look at some of the lessons we can learn as EMS providers, even emergency medicine providers, and how protocols for ketamine can actually improve safety not only for ourselves but for our patients. The Elijah McClain case really raised a lot of important questions about when sedation is really medically appropriate and how EMS providers should maintain independent clinical judgment, especially when it comes from other agencies on scene like law enforcement requesting sedation. All right, let's tackle ketamine a little bit more here. All right, ketamine is really one of the most useful medications we have in emergency medicine and EMS for severe agitation. And if it's used correctly, it will allow rapid sedation, typically while preserving airway reflexes. I'm going to ask you to pay close attention here because I think that this is probably going to be one of the most important things I say here. After ketamine administration, patients have to be closely monitored. All right. Waveform capnography is extremely valuable because it detects hypoventilation early. All right. So end-tidal CO2 is standard of care. Continuous cardiac monitoring, pulse ox, frequent airway assessment is going to be key to maintain the safety of the patient. Now, I happen to be a medical director for a number of EMS agencies, and a few of them do carry ketamine, and anybody under my medical direction that does carry ketamine has this as their protocol language. All right. Do not use ketamine or any other sedative hypnotic agent to chemically incapacitate someone solely for law enforcement purpose and not for a legitimate medical reason. All right. So what I ask you to do here is, if you do carry ketamine or you plan on carrying ketamine, talk with your medical director and discuss some type of wording that might go along these lines that you can place in your protocols. Now, I want to switch gears here and talk a little bit about excited delirium, or the term excited delirium. And this term has really become controversial in recent years. It's going to probably be safer to move the mark here and use different descriptions such as severe agitation or hyperactive delirium, especially when it comes to documentation or providing reports to receiving hospitals. Now, recently ketamine has received a lot of bad press because of some bad outcomes out there. And that scares me because I'm concerned that EMS will steer clear, or some EMS agencies will steer clear of ketamine use. And I don't want that to happen because it's going to remain an important medication in EMS when it's used appropriately. But we have to have proper, clear protocols. We need to be monitoring each and every patient that we're administering ketamine to. And we have to use our clinical judgment. Thank you for joining me today for episode 1 of Medic Outpost. And remember, when you're the medic on scene, the emergency department begins with you.